So we work pretty close with a lot of local chiropractors for scoliosis treatment, where we try to accelerate some of the healing and ligamentous stability while they keep everything in alignment.
Hey, smart chiropractors, welcome to Clinical Conversations. I'm Dr. Jeff Langmaid here with my co-host, Dr. Jason Deitch, and we have a special guest today, Dr. Jason Markle. We met Dr. Markle about a year ago. We have been super impressed with the practice that he's been able to build within the Centeno-Schultz Clinic. We wanted to bring him on to have a conversation around your campaign of the month, which is all about kids and care. And we wanted to get a different opinion, a different angle, and also open it up to questions around how to take care of not only maybe any children, but your children when they inevitably encounter challenges in their life. And I know we have all been there. Dr. Markle, thanks for taking a few minutes coming on and chatting kids and health with us today.
Yeah, no, thanks for having me, guys. Looking forward to it.
You got it. So I'm going to kick it over to you, Jason, to ask a couple of questions of Dr. Markle, because I know as you and I were prepping for this, we were thinking about it really in terms of what we've experienced with our own children. So I want to kick it over to you to lead the conversation here.
That sounds fantastic. As everybody knows, for the Smart Chiropractor, this month is all about talking about children, talking about how important chiropractic care is, spinal alignment is for children. But we want to bring Dr. Markle on because when these issues are either too traumatic, whether the injury is too much, whether they have sort of gone through chiropractic care and still have issues that are now sort of potentially subject to needing surgery, potentially drugs, and so on. Just about every chiropractor I know is looking to do what they can for our own families, let alone our patients, to really address these issues in the most holistic, most natural way possible. So let me just sort of start off, Dr. Markle. What are some of the most common, injuries, orthopedic issues, whether they're chronic or due to sports or anything like that, that you're noticing in kids, maybe more and more these days? Just sort of open up the conversation around what are the things that are really common that have a solution that many people who are facing, basically living on drugs or potentially irreversible surgery could potentially be avoiding?
Yeah, thanks, Jason. And yeah, we see kids and pediatric population on a daily basis, sort of all over. Spine, per se, saw one this week that has Foreman's disease. So it's typically growing pains, right? So kids and adolescents are sort of like dynamic individuals versus like older individuals that are mature. So they're continuously growing. Sometimes their skeletal maturity accelerates their musculoskeletal maturity from ligaments, muscle, tendons in their spine. And that's when we start seeing the neuromuscular scoliosis, their scoliosis at early ages. So we work pretty close with a lot of local chiropractors for scoliosis treatment, where we try to accelerate some of the healing and ligamentous stability while they keep everything in alignment. So we've mirrored that practice pretty well over the last couple of years. We've got a bunch of kids and high school athletes that we work with. And then like traumatic stuff. So we see a lot of pars fractures. So facet injuries, pars fractures, disc injuries. And pars fractures are the big one because then they're talking about fusions, laminectomies, and kids in their teenagers, that could be a death sentence long-term wise. So we've worked well with the chiropractor, keeps them pretty stable, make sure there's no substantial lethesis going on. And then we ideally treat all the soft tissue structures around it. And sometimes we can actually heal the bone itself, as well as it stays in alignment. And sometimes we can heal all the soft tissue around it to stabilize it, where the bone sometimes doesn't heal, but symptomatically kids are able to get back to their normal lives, athletic careers. I've treated some of the top baseball pitchers in the last couple of years that got car accident, had pars fractures. Obviously, they go into depression, think their career's over, as kids like to do. We treat them, get them back pretty healthy. And now a lot of them are in minor leagues and college programs right now. So we've had quite a bit of experience with pediatric spines and pretty good relationship with chiropractors, co-managing, getting patients back healthy.
That's awesome. I want to geek out a little bit because you brought up some, I think, important terms that us as chiropractors talk about a lot, and that's that 5-1 juncture, right, where L5 meets S1, a spondy. We might see a pars defect. You alluded to the fact that sometimes there can be actually healing. Sometimes it's about increasing the stability in that area. I'd love for you to dive a little bit deeper in terms of the technology that you guys utilize and what's typically your goal, and just I'd love to know, when do you see that it starts to become less likely that you're going to get union? What's that skeletal maturity look like? I'd love to know your experience and just break that down a little bit.
Yeah, so after we evaluate the patients, we typically get a couple of imaging, so flexion extension x-rays, see how dynamic it is, making sure the approximation of the fracture is still apparent. And that's one big thing, as long as we have approximation of the fracture. And then getting other images, sometimes CT scan if they're super young. We don't want to put too much radiation, so we'll get like an MRI, see if there's any sclerosis or any signs of saying old lesion versus healing, like bone marrow edema, showing some reactive changes. That means it's still biologically active in the area. If everything's approximated, there's still biological activity in it versus scarred over, then we have a chance of ideally getting healing. And that's something we do a pretty precise x-ray guided image with typically a bone marrow treatment, which houses your stem cells that accelerate healing of bone. There's lots of evidence for like non-union fractures, using that to heal those type of things. So we just use that with an injection directly into the fracture line. And then we typically brace them and continue about 4 to 6 weeks later, continue with some chiropractic care, keeping them basically everything in alignment, allowing that fracture the best chance of healing. But there's also the whole network of ligaments around that 5-1 junction, supraspinous, interspinous, ilolumbar ligaments. All those network of ligaments, we can target those ligaments as well, because with any fracture, it's not just the bone that breaks, it's all the soft tissue injuries that happen with it, sometimes even a disc injury. The disc is a stabilizing unit too. So we treat the full functional spine unit, the ligaments, the tendons, the muscles. A lot of times, a lot of atrophy of the multifidi. So we try to change everything we have the power to change and help heal. We try to hit it all to make sure we can get the best chance of healing long-term wise.
That is awesome, and I know super effective as well. I know this is a new conversation for a lot of chiropractors. We've been living in a world where it's either chiropractic care, and if for whatever reason the patient gives up too soon, or you've gone through enough care that symptoms still persist, then it seems to be sort of one extreme or the other. What I love about what you guys do at the Centeno-Schultz Clinic is your philosophy. And your philosophy is really, I'll say, sort of in our camp of chiropractors to help the body heal itself, as opposed to the traditional medical approach, which is, basically let us, drug it, cut it, burn it, whatever it takes to alleviate the symptom at all costs, short-term and long-term. My question for you is, what are some of the popular surgeries that children do end up having if they don't get to you guys first? Are there certain sort of popular surgeries that, if they don't end up in your office, you kind of pretty much can count on they'll end up in an orthopedist, they'll look at it this way, they'll recommend those surgeries, and lots of children, unfortunately, end up in, as I know Dr. Centeno calls it, this irreversible pathway. Once a surgery's been done, you can't undo it. What are some of those popular surgeries that kids end up going to get if they don't see you first?
Yeah, nowadays, if they're talking about a pars fracture, that 5-1 junction, they're talking about a fusion, facet fusion. So there's small little, basically brackets they can put directly over the pars region in the facet, pseudo fusion. The problem with that, long-term studies aren't that great. And then when you start cutting things, you change anatomy, you change biomechanics, as you know. So that's one thing, especially with the pars fractures. I've had a bunch of colleagues from Andrews Institute send me kids that they were about to fuse, and they send them to me, and we're able to sort of avoid that and keep them in their athletic career, because sometimes fusions at a 15-year-old who's a high-level athlete, thinking collegiate, professional level, potentially you're almost at a death sentence. Within 10 years, you're going to get so much arthritis developing. And then with the scoliosis, anybody over like a Cobb angle of like 20 degrees, sometimes they start talking about rods, And then again, same thing. The rods are going to have multiple repeat surgeries over their course of their growing adolescence. So we can take a little bit more holistic approach, a little bit more less invasive approach to that. We've had pretty good results with that. Again, usually, especially with those curves, chiropractors have a pretty good idea. Decent ones will take imaging of the curve and start adjusting and trying to reverse the curve from X-ray standpoint adjustments, and then bracing. Then we sort of augment that with some ligament work, trying to help accelerate some of what they can do.
To that point, I'd love to follow up. Again, I was having a great conversation with Dr. Centeno the other day. One of the comments he made that I'd love for you to sort of comment on is that, he acknowledged that many of us as chiropractors focus on the hypomobility, what we think of as the fixations or the subluxations, where there's lack of movement or motion, putting pressure on nerves and the soft tissues and so on, causing, basically hypomobility or subluxation. You guys work sort of similarly, but from a hypermobility type of a philosophy, which is almost, I'll say that the same from the standpoint that we recognize that improper motion, either not enough or too much at certain segments, can cause instability of the segments themselves, and all kinds of neurological and other type of soft tissue cascade events. Could you comment more on sort of your hypermobility approach versus knowing our, the solution to hypomobility is put some motion into it? How do you guys approach the hypermobility with, again, the similar philosophy and then the impact that has?
Yeah, sometimes it's chicken or the egg. What came first, the hypo or hypermobility kind of aspects of it? If you're looking at a spine, you see a lot of bone spurs that limit some of the functional movements and things like that also create some hypomobility. But if you take that back 5-10 years, well, why the bone spurs develop, why things like that start coming and losing function, it's typically the opposite end of the spectrum. There's hypermobility, where a segment moves excessively, the body has an innate response trying to stabilize it internally, and that's where the bone spurs and they start laying down extra ossified bone lesions around the spine, and then things stop moving, and then all of a sudden that's when the pain starts setting in, things like that. So we look at it as trying to be a little bit more proactive, treat the hypomobility, prevent the bone spurs from forming, and then we can utilize someone that works on the body to work on biomechanics and getting the physiologic function of that joint to return to function. So it's all about chicken or the egg. What came first, the bone spur, or did we have an accident 10 years ago, created some hypomobility, instability, and then started leading down that hypomobility road?
Gotcha. I have a two-part question for you, and it kind of ties into what you're describing in terms of, as somebody develops, those changes occur, and some of them are good, and some of them are, become degenerative over time if the right things aren't done early on enough. My two-part question for you is, number one, is there anybody that is too young? Is there any minimum age of what you guys tend to treat and see? That's number one. And number two, I know as chiropractors, many of us that have taken care of kids in the past, we love it because they're so dynamic. The results are fantastic. So what do you see with the younger populations compared to the older with the care you deliver? And is there anybody that is kind of too young to be able to go through an evaluation with you?
The youngest person I think we've treated is probably 7 or 8 years old. Myself personally is around 10. Gymnast screwed up her elbow. But really, it's all about pathology, what's actually going on. I wouldn't say anyone's too young or too old at this point. We don't do like infants and things along those lines, just because those guys heal miraculously to begin with. They're pretty Gumby. So usually it's somewhere in the athletic range, in that probably 7 and above. And then really there's no limit to what we can do, but all depends on what we're treating and if it makes sense. From a pathology standpoint, I treat a lot of osteochondritis dissecans, where kids start getting basically avascular necrosis of their bones from trauma, for what have you. Had good success with that, where previously it's just more of like surgeries, taking out the dead bone and start grafting, things like that can create some long-term issues. So not sure if that's in depth, but We basically treat any and all kids if needed, but we always try conservative routes first. We got a lot of kids with growing pains, especially in their spine. They start getting a lot of back pain, neck pain, thoracic pain. Look at their posture; they're hunched over. Their musculoskeletal system isn't catching up to their maturity of their skeletal system. So it's like, hey, nothing to do right now. Let's give it time. Keep working with the chiro, keep working with the PT, and things typically resolve on their own. So we don't do things if we don't have to. But if it goes on long enough and some acute issues, there's definitely things we can help with.
Dr. Markle, that's exactly what I wanted to sort of dig in a little bit deeper on as you were sort of ending there is, when is the right time for somebody to reach out either for themselves or their children? What's your philosophy on it? Is it, early on when, it's just sort of early onset, you had a trauma, should they give it some time to heal? Should they give it, a series of adjustments and chiropractic care for a period of time? Should they be trying, PT and exercise or other things and then come for an evaluation? Or is it better early on for you to sort of, get a baseline early on or see an injury soon after it happens as opposed to, letting time go by, perhaps scar tissue build up, healing, out of alignment? What's your philosophy and kind of when the best time is for, I guess, especially children, as we're talking this month, for them to reach out? And the second part of that is, how do they reach out? What does it look like? What's the process? You're doing telehealth still? Do they contact you? Just talk us and walk us through when's the right time and how do they do it?
Sure. For any acute injuries, definitely the sooner we see them, the better, just so we can get a sense of what's going on and then fully assess the situation. If something is urgent where someone's getting neurologic issues or some compromise there, that's when sometimes we jump in. It's like, hey, let's get this treated sooner. If nothing is urgent where we're talking about, hey, this could be a surgical option if we let this go long enough, then we can give it time. The natural body's healing mechanisms is probably 6 to 8 weeks after acute traumas. So do all your other non-injection based therapy, right? That algorithm, minimally invasive to the most invasive, being surgery, minimally invasive, physical therapy, chiropractic care, non-injection based therapies, sometimes medications, see how the body responds. And then sort of if the body needs a little bit of help, and if we're not really getting over the hump, then that's when we sometimes step in and intervene.
That's great. And one more question for you. I know we're running tight on time. You are stacked with patients, but I want to know a little bit about ACLs before we wrap up. I know this is a big source of injuries, especially for kids that play sports, are ACLs. Is there a point where it's too ruptured? What's the grading scale? What do you guys look at? And what do you see for success, specifically relative to ACL injuries in that younger population?
Yeah, we do see a lot of ACL injuries and treat them. We published a randomized controlled trial looking at ACL tears, even full thickness tears. So we've got a pretty regimented MRI protocol that we use when we evaluate an ACL. We're looking at the fiber types. Is everything the radiologist read will probably say full thickness tear, but if you actually look at the imaging, sometimes it's a full thickness retracted tear, meaning it's fully blown and all of a sudden pulled backwards and there's no connection between the origin and insertion. But if we look at the full thickness tear and it's just more blown apart, that means that conduit between the insertion, the tibia and the femur attachments are still intact. So that's something that we can use a image guidance x-ray to actually get the bone marrow stem cells and fill that void. And we've seen great results with that healing. Then we also look at something called anterior tibial translation. The function of the ACL prevents the shin bones from sliding forward, the tibia. So we can measure that offset on the MRI. If it's beyond a certain millimeters, we know even if we get it to heal, it's still going to be somewhat unstable. So there's pretty much hard set criteria. Probably about 70% of all ACL tears we think we can treat pretty well and get it to heal. And the beauty of that, less surgeries, less post-traumatic arthritis develops, and we preserve the biomechanics as well as the kinematic sense of the natural ACL. It's a proprioceptive organ, so that helps protect the knee long-term wise. So we're doing some cool stuff with that, and a lot of people are finding us throughout the country. And we do a lot of telehealth evaluations as well. So patients contact us, our office, our care coordination team. They send us the imaging. We can set up an easy telehealth evaluation, especially if we have the images, talk them through what the MRI is showing, and we can give them a good realistic expectation off that MRI. It's like, oh yeah, this is something we can definitely heal. Or it's like, oh, there's some good, some bad stuff. It might be somewhere in the middle, or we just recommend surgery.
Dr. Markle, I know you're short of time. We are too. We want to get to the point, get in, get out. We thank you very much for your time. For those of you watching, we want to let you know that, this is I'll say smart benefit of being a member of the Smart Chiropractor. We are proud, very proud, I'll say, to work with the Centeno-Schultz Clinic. If you want to do some research on who they are, what they've been about, what they've been doing, how they've pioneered regenerative medicine and specifically regenerative orthopedics over the years. Dr. Markle is basically one of the top doctors in the world working at what I believe is the world-class clinic. And our motivation is to really, Dr. Jeff has brought together the evidence-based chiropractor working with medical doctors and chiropractors, and we really believe that there's a right way to do it, that there's a lot of talk about, I'll say inappropriate MD-DC type of relationships that are not really based on what's doing best for the patient, but there are refreshing types of relationships where, like the doctors at Centeno-Schultz, like Dr. Markle, like Dr. Langmaid, myself, our philosophy is really focused on doing what's best for the people we are serving, whether that's us serving you, the chiropractors we work with, or you serving the patients you're working with. Having access to experts in this category we think is super smart and essential in today's day and age to really make sure you're helping your patient, helping yourself, your family, your staff, your team, your patients, having the knowledge and resources for who the world's foremost experts are that can help people avoid drugs and surgery when they can. And that's really what we're all about. We know that that's what Dr. Markle and the Centeno-Schultz team is all about. That's why we do these. So stay tuned when you see clinical conversations with the doctors from Centeno-Schultz Clinic. Bring your questions, bring your cases, ask what you want to know, because these doctors are very excited to work with our team of smart chiropractors, whether it's for you, your family, your patients, whatever it may be. We have found the needle in the haystack, so to speak, of those really excellent doctors that align perfectly with who we are, what we do, to best serve our patient population. Dr. Markle, any final comments about kids? I know if people have questions, they can leave them down below. We'll keep an eye on them. If there's anybody that wants more information about how to work with you, you can ask down below or reach out to the Centeno-Schultz Clinic directly, specifically ask for Dr. Markle. Any closing comments, Dr. Markle?
Yeah, no, I appreciate you guys having me on. And yeah, it's a great topic. And if anybody out there has any questions specifically for me, feel free to give my email. They can always reach out to me personally. We have a lot of good relationship with a lot of the providers where cell phones, email is the best way to get in contact with us, especially from a clinical standpoint. So we can don't delay care and keep the communication going. So I appreciate you guys reaching out to us and looking forward to working with you.
That sounds great. Have a great day, and stay tuned for the next episode of Clinical Conversations in a couple weeks. Dr. Markle, thanks for coming on. Jason, thank you as always. We'll talk to everybody soon. Bye-bye. Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.